Hello everyone, I hope that you enjoyed your weekend. Today we are going to talk about antipsychotic medication, where we will discuss about their mechanism of action, clinical uses, and safety consideration. There are both main types, typical and atypical antipsychotics. Let's start. What are antipsychotics? They are a class of drugs used to treat mental health conditions characterized by psychosis such as schizophrenia and bipolar disorder. Their mechanism of action is by working as altering the activity of neurotransmitters, particularly dopamine, in the brain, helping to reduce psychotic symptoms like hallucinations and delusions. The first type, or the first main type, is typical, first generation antipsychotics. Its mechanism of action acts as primarily block dopamine receptors in the mesolimbic pathway. For example, such as haloperidol, chlorpromazine, thyroidazine. Side effects as extrapyramidal symptoms, including dystonia, Parkinsonism, and akathisia. The second type, atypical, second generation antipsychotics, has introduced at year 1990s. It acts by blocking both dopamine and serotonin receptors. The examples of atypical second generation antipsychotics as Risperidone, Olanzapine, and Clozapine. What are the mechanisms of action and pharmacological profiles? First, we have dopamine hypothesis. Second, we have serotonin modulation. Dopamine hypothesis, where antipsychotics primarily target the dopamine system, is in the brain. They block dopamine receptors, reducing dopamine activity. Where serotonin modulation, as atypical antipsychotics also modulate serotonin activity, contributing to their broader therapeutic effects and lower risk of extrapyramidal symptoms. Efficacy and therapeutic indications. First, schizophrenia. Second, bipolar disorder. Schizophrenia, where both typical and atypical antipsychotics were first and second generation of antipsychotic drugs, are effective for managing psychotic symptoms. Then, at bipolar disorder, atypical antipsychotics, which is the second generation antipsychotics, are often used for managing manic episodes, particularly for those with mixed features. What are the adverse effects and safety considerations? Metabolic syndrome, cardiovascular risks, and extrapyramidal symptoms. Metabolic syndrome, we could find that weight gain, which increased cholesterol and triglycerides and insulin resistance. Cardiovascular risk, prolonged QT intervals, increased risk of stroke and heart failure. Finally, extrapyramidal symptoms, muscle stiffness, tremors, and involuntary movements, primarily seen with typical antipsychotics, which was the first generation. Finally, antipsychotic medications play a crucial role in managing psychotic disorders, and it's important to choose the right medication based on individual needs, also from the physician who are specialized in antipsychotic drugs. Thank you so much for watching. Please don't forget to subscribe, like, and share. See you soon. Bye.